I have a comment. My name is Leanna Orsolini. I'm from Bon Secours Health System. I'm part of the forum. What you said so resonated with what our 6-state integrated health system of 20 hospitals, 5 nursing homes, hundreds of ambulatory care centers is working. And so at our level, at the system level, we have interprofessional teams that are very large. And part of our work is to trickle it down and to bring people from point of care from all different health professions to that system level, whether it's to work on throughput, quality, safety, and I just would like to say that if you're teaching different health professions, to think about utilizing some of those interprofessional teams at the highest level for part of your clinical experience. Because the richness in learning is amazing. And it's gotten to the point, and so I'm almost ashamed to say this, it's gotten to the point where you forget to introduce that you're a nurse, like I just did right now, because you're just intrinsically a nurse or a physician or a pharmacist or a dietitian, and you're so part of this new identity called this interprofessional group that it doesn't matter so much that you need to identify where your original training was from. And that's a real example of decreasing the hierarchy and having humility and just being part of a group that focuses on the high stakes, which is the patient safety and quality of care. Care coordination is really pushing us into a new realm of interprofessional practice where we mix providers from inpatient and outpatient and those that go into the home. And technology, and we just finished putting all of our hospitals on an Epic-based EHR, and we have many of our outpatient practices on that. Technology is helping us to have just-in-time teams and asynchronous teams that cross geographical boundaries. So, you know, I'd like to eventually, in a future conference, kind of unpack what we mean by interprofessional team. And as we look at outcomes, what are all the types of teams and what are all the types of contexts and how do they operate? And lastly, when we look at outcomes, let's look at what happens when we don't work in teams. I won't say which health system this experience, true experience happened, but when a pharmacy committee decided to buy a new kind of smart pump and didn't ask the nurses to come to the table, the nurses, it was a very laborious process to use the smart pump. And so nurses started to do what they do best, workarounds. And we had an almost never event happen. And that is an outcome, a negative, or, you know, you could say if nurses had been asked to come to the table at the beginning, perhaps we could have prevented that almost never event. Thank goodness it didn't happen, but we need to look at the outcomes of not working in teams as well. Thank you.
Let me just focus a little bit. We need, thank you, Leanna, we need to keep the questions brief and focused. And what I want to do is make sure that the committee has had a chance to talk with Mattie. So we're going to start with the committee, and then we'll open it up for more general questions and comments. Committee, questions for Mattie?
Part of, I just can say that part of the motivation for me to address this integration issue responded to the committee's makeup.
So I have a question, Mattie, while the rest of the committee collects their thoughts. Thank you for a provocative presentation. I wonder if you could say a little bit more of your thinking about the bidirectionality of the education and the training piece, the practice piece that you talk about, because that connection seems to me at least to be central to developing a comprehensive view of what interprofessional education / training is all about?
I'd be glad to, because I think, first of all, I think the emphasis has been on training and not necessarily on outcomes. I don't know what the evidence is for the outcomes, either in the practice setting or for particularly the educational outcomes of backing up what we've learned in practice to the educational realm. And that I would think that that evidence perhaps is stronger in the patient safety and to some extent quality area than in some of these other areas. But the point is not just to focus on those outcomes, but to recognize that there's a broader agenda here and that there are places we have not yet gone. For example, Jillian Barkley from the Aetna Foundation says, where you find good care coordination, you find good interprofessional practice. So care coordination, access, which we tend not to think of, as we know, and Malcolm, I'm going to put you on the spot, but not so longer because you're now retired, but access has been a big issue in the VA. And it's very much a part of the patient experience and very much a part of what we need to address in terms of how interprofessional work might address access issues. So the point is, although we may find more evidence in one area than another, and I don't know whether that's going to be true, but there's been so much more emphasis in the patient safety area that the evidence may well be more there than in other areas, but that we need to push beyond that. So the learning, I think, goes in both directions. That is, we need to capitalize on what we've learned so far, but recognize that there's another set of initiatives here that are taking a broader perspective and backing this up to future practitioners. So while there's good emphasis on changing the way current practitioners work together, we still have not essentially demonstrated the missing piece, which was alluded to earlier. I think I remember Carol Aschenbrenner's comment. We don't know what that connection is between interprofessional education and the triple aim outcomes. And that is a process. And somewhere in the middle are learner outcomes, which we do have reasonable evidence for globally. And I hope that further speakers in the open session today will speak to that. But it seems to me we have a lot to learn from each other, and it's in the context of recognizing overall that there needs to be closer relationships. And one set of those closer relationships is what knowledge we can gain in either direction. It seems to me it has to be a win-win situation. Not easy, but a win-win situation.
Other questions? Brenda.
Brenda Zila, University of Washington. Mattie, I wanted to address the bidirectionality learning, and I think in my own experience there's many challenges to that. And some of this has to do with the principles of developing IPE activities and who's at the table. And I know that Joe Endish's paper talks about some principles around co-creating, co-producing the IPE activity. Is that we have a disconnect in how we define faculties. We have faculty in academia who don't practice. We have our own hierarchy within what preceptors and whomever we call the folks that go with our students. It may not be the same folks developing these activities. So this bidirectionality of learning from the practice side and bringing it back to the academic side doesn't always happen. And I think that's probably harder in nursing when faculty, and not all faculty, but those that are PhD RNs, like myself, who does not have a clinical practice, involved in the classroom-based, simulation-based activity. So there's that disconnect, which is why I think one of the things we'll look at is who does create this? Are there practitioners involved in the creation of the activity so that there can be a bidirectionality sharing of the information, but also having patients and students on that team as well, because they're the ones that will be on both sides.
Right. I'm total agreement with your comments. I think that this is essentially, in many ways, a new frontier, right? But the point of my comments was to help us think forward in the context of looking backward, and to say that in addition to the evidence piece, we need to look at methods in a broad way, both from the point of view of assessment and what methods will get us to the point of being able to demonstrate those ultimate outcomes. So there are questions that haven't been answered, like if we do that integrated piece and do a better job of preparing students for entry into practice, are there consequences on the practice side? I know we've heard in the forum that right now there's a lot of retraining that needs to go on in order to get graduating new practitioners in line with what's happening in practice. And practice is changing so dramatically, so quickly, that our efforts on the education side need to be ramped up. We need to move more quickly than we traditionally have. So I think there are challenges to making this bridge, but I think to make progress, we need to go there.
I just wanted to ask, when you were talking, Mattie, it reminded me of your paper that you published in 2001, where you did a review of the evidence base, and the conclusions were very, very messy. Someone talked about the messiness, and you talked about the interventions being very, very different, the outcomes being very, very different, the approaches to methods that they've used. So what we're looking at is a very, very heterogeneous sort of set of studies. I just wondered, when you were sort of reviewing and doing your work for this presentation, thinking about this paper in 2001 that you published, have we come any further forward, or are we still where we're at? Are we still stuck in the 70s?
Oh, well, and there's a piece that goes back earlier than that, something like conceptualization and measurement issues in demonstrating the outcomes of team-based care. Have we made progress? Yes, we've made progress. But we haven't reached the tipping point, I don't think. We've made progress on the practice side. We've made progress on the education side. But as I said, we've done this pretty much in siloed activity. And so the challenge is, one of the major challenges is bringing that learning together. But I do think we've made progress, and I think the movement is forward. The point is, how can we join forces to get where we all want to go, which is better care and better outcomes. And we need all the voices, not just in education, in practice, but as I said at the end, within the limits of what we can do from an educational perspective, because we know from lots of writing, and I can cite the recent Salas and Rosen paper in particular, that says we can do a great job on the training side, but there are so many other variables in the practice setting that, that really are critical in making this all work. So leadership issues, sustainability issues. Salas and Rosen point us to a number of practice factors that need to go along with the training, and we have those on the education side as well. And I was thinking about this, and I thought about the hidden curriculum as a piece on the education side, that if we don't address the hidden curriculum, we can sort of insert interprofessional education experiences, but if we don't deal with the hidden curriculum, then our students are getting mixed messages.
Albert.
Thanks very much. This is actually a really informative presentation, I thought. So you, early on, you said that we should be innovative about methods.
Right.
And, I mean, I think that one thing which I appreciated more from your talk was that education is siloed and evaluations are siloed, and sort of that's the problem. But in your early papers, and even now, something that you and we are confronting is that a lot of the evaluation hasn't been so good.
Right,
It's not anyone's fault, but it's just messy.
right.
And so when you say be innovative about methods, I think that we know as much as we need to know about the methods. It seems to me more like that we just need to be more disciplined or more careful about applying those methods. What do you mean innovative about methods?
Okay, good question. And I'm hoping that others will speak to this and that you'll have a conversation in the committee about this too. But, I'll just take as an example, and I'm a nurse sociologist, so I know the standard of randomized trials, for example. How quickly and how informatively are randomized trial approaches to demonstrating the evidence going to help us get to where we need to go? Or are there newer research methods that will help us? We're in the era of big data. How much can we ramp up in gathering information in those ways that weren't available to us earlier, frankly? I know there's a big promise there. We need to see where it's going to take us. But I'm hoping that the committee will be open to considering new ways of researching and evaluating this question about the impact of the interprofessional education and training work on outcomes. So that's an example. Then we've got the assessment methods, and there are newer assessment methods that we need to consider that are certainly in the sphere of folks who are expert in this area, but who haven't, those methods I don't think have been fully engaged in the work we need to do. So I think both methods of assessment and methods of researching the outcomes are challenges for us in thinking forward.
Thanks, Mattie. I think we need to move on, but let me just make a quick comment. Much of the rest of the program today will deal with some of these issues of methodology and messy big data and so on. And I want this to be a continuing iterative discussion in which people have the opportunity to raise their voice. But thank you very much, Mattie.